Neurology Quiz number 23. What is Balo's concentric sclerosis? This is a rare variant of multiple sclerosis characterized pathologically by alternating rings of demyelination and relatively preserved myelin. MRI shows alternating bands of different intensities. It can be seen as a solitary mass and less commonly as multiple lesions. It is usually seen in adults and is more common among people of Han, Chinese, and Filipino descent in whom multiple sclerosis is less common than in Caucasians. Clinical features vary depending upon the site affected, and focal signs and symptoms such as weakness are common. Additional features include headache, seizures, cognitive dysfunction, and altered sensorium. The disease is often monophasic and can have a rapidly progressive course, while other cases are subacute. A subgroup of patients may have a relatively benign course similar to MS. On MRI, T2 weighted and FLAIR images, lesions appear as concentric rings or whorls with alternating high and low intensity, and on T1 weighted images, alternating bands of hypointensity and isointensity are seen. Diffusion weighted images often show peripheral restriction, and gadolinium enhancement can be seen at the lesion edge. Other lesions typical of MS may be seen. CSF oligoclonal bands are uncommon. Differential diagnosis includes neoplasms, brain abscess, strokes, and patients often undergo brain biopsy because of confusion with such conditions. Historically, Balo's concentric sclerosis was felt to have a poor prognosis, but MRI assessment has shown that lesions can vary in severity and patients have been known to recover fully. Treatment is usually with IV corticosteroids or plasma exchange or both, and additional immunosuppressant drugs are added in refractory cases. It is unknown if disease-modifying therapy is necessary or helpful. This slide shows the MRI appearance of Balo's concentric sclerosis. Figure A shows an actual T2 weighted MRI with very well delineated concentric rings within the lesion, whereas figure B shows a corresponding actual T1 weighted MRI. This is from Purohit B et al. In Case Reports in Neurology in 2015. What are the uses, dosage, and side effects of prothrombin complex concentrate or PCC? Prothrombin complex concentrate contains vitamin K dependent coagulation factors 2, 7, 9, and 10. It is FDA approved for the urgent reversal of acquired coagulation factor deficiency induced by vitamin K antagonists or VKA like warfarin in adults who have acute major bleeding such as intracerebral hemorrhage or patients on warfarin requiring urgent invasive surgery or procedure. PCC is sold under the brand name Kcentra. Traditionally, vitamin K and FFP were the preferred method for warfarin reversal. However, PCC has several advantages as described below. Only small volumes need to be administered. PCC contains much higher amounts of clotting factors compared to FFP. One dose of PCC equals 8 to 16 units of FFP. Therefore, PCC can be administered much quicker over a few minutes and provides reversal of VKA effect within 60 minutes. In addition, it can be safely administered in patients with cardiac and renal failure who may be unable to tolerate a large fluid load. As FFP requires thawing before administration, it can lead to a delay in treatment and reversal of anticoagulation. PCC is devoid of leukocytes and as a result is less likely to cause transfusion reactions. PCC undergoes viral inactivation treatment and there is very low risk of transmission of viral infections. Dosing schedule for VKA reversal is according to INR and is noted below. Repeat dosing is not recommended. Vitamin K should be administered concurrently with PCC as warfarin has a long half-life. This is given in order to maintain levels of vitamin K dependent clotting factors once the effects of PCC have worn off. Most common side effects are headache, arthralgias, and hypotension. Allergic reactions including anaphylaxis can occur. Serious side effects include thromboembolic complications such as DVT, PE, myocardial infarction, and stroke. Current PCC formulations have a much lower incidence of such complications as they contain heparin, protein C, protein S, and antithrombin, which decreases the risk of thrombotic events. Contraindications to PCC include DIC, history of thromboembolic disease including MI, stroke, DVT, PE, or peripheral vascular disease in the last 3 months, history of anaphylaxis or severe systemic reactions with PCC, as well as heparin-induced thrombocytopenia. Effects on the fetus are unknown, and it should be used in pregnancy and during labor with caution and only when clearly indicated. PCC has also been used to reverse the effects of direct-acting oral anticoagulants, but specific reversal agents for these drugs are now available.